This is the Emergency Medical Minute.
I actually had a pretty cool article that I found in JAMA from February of this year. So we've had huge emphasis on sepsis for a while now, right? We're kind of treating it as our bread and butter at this point. One of the issues with it is the serial lactates, right? And making sure that an elevated lactate is getting cleared. And that we use that as a marker for adequate resuscitation, right? So when we do that repeat lactate, usually 1 or 2 hours after the initial lactate, we want to see at least a 20% drop from the initial lactate to know that we're adequately improving the resuscitation. So this study was titled Effective Resuscitation Strategy Targeting Peripheral Perfusion Status versus Serum Lactate Levels on 28-day mortality among patients with septic shock. Long title, long and short of it is they compared cap refill to lactate clearance. And was there any difference in mortality, length of stay, and speed to resuscitation? What they found is simple capillary refill assessment is equivalent to lactate clearance in assessing resuscitative efforts. How to adequately do cap refill? Their protocol, they said, on the index finger on the nail, pressing more or less as firmly as you can to white out the nail for 10 seconds, and then counting how long it takes to become pink again. And obviously, more than 3 seconds is an abnormal capillary refill. And what they said is if you have an abnormal capillary refill and you reassess at 2 hours and you're starting to see a faster capillary refill time, that's just as good as repeating a lactate.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.